Good afternoon to everybody. We'll now start. It's already 2 o'clock. First of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please show your face in the video. As a reminder, please take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown below. The link has already been placed in the chat box. Another reminder, 50 OLETE certificates. We're now on our 57 lectures, pep talk. So you now have a chance to get 50 OLETE certificates. And if you get 50 OLETE certificates, this is equivalent to 1 voucher for an ROJoson telemedical consultation, as shown below. So my request, another request is that those who are not taking the OLETE, which I'm not forcing you to, okay, just type in your feedback in the chat box during the open forum and before we part ways, before we go home, before we separate. Okay, thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face in the video. Show your face before I start. Okay. Ready? 1, 2, 3. Okay. So, okay. Before I continue further, let me just tell you that if you want to ask questions, if you have old ultrasound reports, okay, which you want to ask me questions, just get hold of your old ultrasound and you can do that later on. Okay. Let's start. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021, last year. And from October 23, 2021 onwards, I have been tackling health disorder courses, seen on the left side of your screen, and health issue courses seen here. So this may take 3 years or longer depending on the enthusiasm and depending on my how long I can last with these lectures. Okay. My pep talk today is entitled Breast Ultrasound and Mammogram, okay, Results, Reading and Interpretation. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the importance of reading and interpreting breast ultrasound and mammogram results in their health management. Okay. Let me remove this one. Okay. So The contents of my pep talk today will be the following: general recommendations on the reading and interpreting the lab results with narrative descriptions and conclusions. These are the general recommendations for all types of lab results with narrative description and conclusions, in which ultrasound and mammograms are examples of those tests. Second will be how I read and interpret the breast ultrasound and mammogram. Common practices of radiologists in reporting. Examples of challenges in reading and interpretation. And then my advice in reading and interpreting breast ultrasound and mammogram. Ultrasound of the breast and X-ray of the breast. Mammogram is an X-ray of the breast, okay, are commonly done in the Philippines as well as abroad. Okay. There are other tests that are known to be done on the breast, like the CT scan, MRI, PET scan, thermography, but this will not be discussed here today because they are not commonly done. Okay. Patients commonly present to me the results for reading and interpretation, particularly those with a notation of BI-RADS 4 at the conclusion of the report, which just means suspicious finding or suspicious abnormality. Essentially, when we're talking about suspicious findings or abnormality, we're talking about breast cancer, okay, BI-RADS 4. So these are the alarming reports that are usually presented to me. In this pep talk, I will not discuss the indications for ultrasound and mammogram, but will most probably mention them in my advice, okay, the indications. I will go direct to the point, discussing reading and interpretation of the reports, focusing on the following topics. Number one, how I usually read and interpret the reports, and how radiologists, the ultrasonographers, write the reports, and the common challenges usually encountered in this report. Before that, let me say something on how ultrasound and mammogram are being done, particularly on the medium being used. A mammogram, or an X-ray of the breast, uses low-dose radiation to take an image of the breast, whereas ultrasound uses high-frequency sound waves and converts them to an image, converts the breast, whatever will be seen on the breast, into an image. There's no radiation involved. So basically, the difference is that there's no radiation involved in ultrasound, and it uses sound waves. So this illustrates the mammogram, okay, X-ray source, and then the X-ray. Then the breast is being compressed by 2 compression plates, okay, to flatten it so that a good picture will come out. Okay, so this is beneath the plates is the X-ray detector. So what will come out will be an image of the breast using the X-ray. So, okay, typically this is a normal mammogram, and then this one, there's a mass there. The character of the mass, the picture of the mass will denote that most likely this is a benign cyst, and then this one could be a cancer or not. Okay, and then these are calcifications, white dots. Okay, can also be seen on the mammogram, which are the usual cues for breast cancer. Okay. Ultrasound uses high-frequency sound waves using a probe. Okay, so sound waves will go in, and then it will come out something like this. If there is something unusual that will be seen, okay, it is characterized by the degree of echoes. Sound waves kasi echoes that will go inside. So hyperechoic, this is a term that is being used by the radiologist. Okay, hyperechoic means that there are more echo going in, more echogenic, so it will come out to be more brighter than the normal. And hypoechoic, less echogenic pattern, and then so it should be darker. I'll show you illustrations on this. Anechoic, there's no echoes going in, so that's why it will be colored black like this one. Then isoechoic, the same echogenicity as another tissue, the surrounding tissue, like the fats. Okay. So this is the example. Okay. Anechoic, no echoes going in, kaya black ang lumalabas. Hyperechoic, okay, very bright. Okay. Hypoechoic, konti lang pumapasok. Okay, so darker, okay, than the hyperechoic. Okay. Isoechoic, pareho lang. No? Okay. So, what are most important in the report of the ultrasound are the following data which we clinicians would like to see and which probably you as a patient would like to see. Okay, if the radiologist can discern and give us this information, so much the better. Number one is there really a mass, a buccal, a three-dimensional mass, or just fibrous tissues? Okay, yung makakapal lang balat, no, or laman, no? Then if there is a mass, is it solid or cystic or complex? Because these have implications on the diagnosis. Okay. Usually pag cystic, the complex, usually benign siya. Okay. Solid, pwedeng benign, pwedeng malignant. Okay. So these are the two important questions that we want to know from the radiologist, no? Or from the readings. No? Okay. So most of the time, ito yung nalalaktawan. Okay. So this is a challenge that we will discuss later on. Okay. So after the procedures, both mammo and ultrasound, the radiologists make a narrative description of the findings and then conclusions and other remarks. In the reports issued by the radiologist, there is usually a caveat, okay, an advice to the patient receiving the reports. Basically, there are two words there: correlate clinically. Correlate clinically. When you say clinical correlation, just means gathering all other available medical data and information, such as age, sex, symptoms, signs, and other lab tests to a particular test. When you say particular test, it's referring to the ultrasound or mammo, to determine their mutual and reciprocal relations. Okay, ibabangga lang nila yon, no? And to establish an orderly connection through either comparing and contrasting the results, then with the goal of coming out with a clinical diagnosis that is as accurate as possible. Okay, so that's why the more specific statement that you can see in most of the ultrasound and mammo report is a statement like this: this result is best interpreted by your attending physician, okay, not the radiologist, by another physician, in correlation, clinical correlation, with your clinical data, imaging, and other laboratory results. Okay, so this is what is meant by clinical correlation. Okay. Another statement that will be more specific, okay, this radiologic interpretation is only part of the overall assessment of the patient's condition. Yes, sinabi ko, clinical correlation, you have to gather the other data. Okay, it must be correlated with the clinical, laboratory, and other ancillary parameters for a comprehensive, complete analysis to come out with a diagnosis that is as accurate as possible. The radiology reports are best explained by the attending physician to the patient. Okay, because what the radiologists do is just make a description of what they saw and their possible interpretation and recommendation. But in the end, it will be the attending physician who will make the final decision on what to do on the interpretation. Okay. So before I zero into the ultrasound and mammogram reports, let me tell you first my usual recommendations for the lay people on how you lay people, how to read and interpret diagnostic reports, okay, with diagnostic descriptions in general. Okay. So note that ultrasound and mammogram are examples of such reports. Okay. Last time I classified the lab tests into two types: those with narrative descriptions like ultrasound and mammogram, and those with numeric values like CBC, like cholesterol tests, may mga numbers, no, as part of the results. So we're now talking about results which have narrative descriptions. So my recommendations will be the following for you lay people. You can take a look and read the contents if you want. Okay, mas maganda if you do so that you can learn something. Okay, however, as a lay person, chances are you will not understand and more so interpret the narrative descriptions and conclusions of the certified readers or the radiologist or the ultrasonographer. So have the narrative diagnostic reports read and interpreted by I would emphasize, a trusted physician clinician or your attending physicians, and let him or her make a decision on the report. Okay. So why this recommendation? Because even for us clinicians, I am a clinician, okay, physician clinicians or attending physicians, we have to interpret the words and phrases used by the radiologists and ultrasonographers. And most of the time, we have to read between the lines. Okay? In addition, they have to correlate, when I say they, kami, okay, clinicians have to correlate the findings and conclusions of the readers with the symptoms and signs, other tests, and other circumstantial situations that the patient may have to make a decision whether everything is normal. These are the decisions that I have to make as clinician, whether everything is normal, a finding, if there's some unusual finding, is it a biologic variations, okay, something abnormal that is being suspected, or there is really an abnormality going on. At times, clinicians have to check the accuracy of the reports, so which the lay people will not be able to discern. Okay, so the clinicians will have to ask the radiologists sometimes what they meant by these things. Okay, what are their actual findings? Okay, so they may have to have discussion with the readers of the narrative diagnostic reports. So ultimately, the recommendation is to have the narrative diagnostic reports read and interpreted by a trusted physician clinician or your attending physicians, and let him or her make a decision on the report. So at this point, let's now focus on the ultrasound and mammogram reports. I will present first how I usually read and interpret the reports. As a breast specialist, these are what I usually do. First, I read the reports and take note first of any red flags for cancer. Okay, that's my priority. Okay, so basically, when you do ultrasound, mammogram, your main concern is there cancer or not? Anyway, right? Okay, so take note first of red flags for cancer in the reports, both in the narrative description and the conclusions. Okay, but I usually first take a look at the conclusions. Okay, in the narrative report, there are two types of two categories of description there. One is the narrative, the other one is conclusion. Okay, so I first take a look at the conclusions. So if there is a BI-RADS conclusion, I take note of this first. When you say BI-RADS, it stands for Breast Imaging Reporting and Data System. Okay, so all over the world, this has become standardized. They use this method of making a conclusion. Okay, so as to standardize the diagnosis. Okay, so when you say BI-RADS 4, 5, and 6, these are red flags for breast cancer. Because BI-RADS 4 means suspicious for abnormality. Suspicious pa lang, but usually suspecting cancer already. Okay. BI-RADS 5, mas mataas yung hinala. So it says highly suggestive for cancer. Okay. You can just see by the use of these terminologies, there's no such thing as talagang perfect or absolute accuracy, 100% certainty. May konting subjectivity. Kaya may suspicious, may highly suggestive. Okay. So if there is no BI-RADS conclusion, like 1, 2, 3, 4, 5, 6, okay, then I look at the conclusion or impression. Kung minsan may mga phrases or terms or sentences that will appear like suspicious for breast cancer, okay, or breast cancer is suspected or should be considered. Okay, kung minsan hindi nilalagay ng BI-RADS conclusion yung radiologist, they just put there suspicious for cancer or suspected for cancer, etc. Okay. So if there are conclusions for possible cancer, I then look at the narrative. Kanina conclusion, inuna ko yung conclusion, then I go to the narrative descriptions and study the basis. Anong basihan ng radiologist on making the conclusion? So if the bases are valid, then I tentatively accept the conclusions. Okay. When I say tentatively, because I still have to do the examination of the patient's breast. Okay. So I have to correlate. Okay. Importante yung correlation. I still have to correlate the reports with the physical findings as well as other data and information, such as other tests that has been done and also the data in the history, okay, and on the historical data. Okay. Notable words in the description that will be cues for cancer are the following, okay? So I will look for these terms, okay? Solid mass with ill-defined border, okay? Parang ganito, if you look at this X-ray plate, this is an X-ray but this is an ultrasound, just the same, okay? Hindi siya malinaw, okay? Okay, ill-defined border. And then solid mass with lobulation, may konting bilog-bilog, ganito, okay. And then enlarged axillary lymph nodes, armpit lymph nodes on ultrasound is another scary phrase. And then mass with speculated border, ito na, on mammogram, this is speculations, no? May mga spike, okay. So this is a very important cue for cancer. And then clusters of microcalcifications. Mamaya, di mga napakita ko sa inyo yung mga tuldik-tuldik, no? Okay. Note here that if they mention cystic mass on ultrasound, these are usually benign, 99% probability. Okay. So let's always hope when you have ultrasound and mammogram, ultrasound, may lalabas ng cystic mass na lang kung may bukol, no? Basta cystic mass, okay, you should not be anxious anymore, okay? Because 99% probability of cystic mass is benign. Okay. So as I said, ito yung mga cluster of calcification. Malilit na tuldik, no? Pero kumpul-kumpul. Okay, cluster, kaya cluster. Kung scattered siya, hindi siya suspicious for cancer. But the moment is kumpul-kumpul siya, we start suspecting breast cancer. 30% of the patients with such a picture will have breast cancer. So the other scenario is that if there are uncertainties or incongruencies in the basis and in the report, then me as the clinician, I examine the patient, particularly the breast. I palpate it very carefully and then make a decision. So the decision that I will make essentially is whether to repeat the ultrasound and or the mammo in another institution to be read by another reader. Ibang center ang gagawa, okay? Parang second opinion. Okay. If the reports do not contain red flag, okay, or cancer, just the same, I also scrutinize the reports to check for any incongruencies. Kung minsan may makikita akong mali ang mga wordings, mga reports, no? Okay, I'll just make sure that tama yung pinag-uusapan namin, okay? So I also examine the patient breast to correlate the reports with the clinical findings. Okay. So hindi porke walang red flags, then okay na yon, no? No. I still have to scrutinize the reports and I also have to examine the patient's breast. So whatever be the report, whether merong mga red flags or not, okay, I correlate clinically. Okay? Meaning, I particularly examine the patient's breast. Pinaka-importante ito. It's a must for all breast specialists, and then decide and explain. Okay? Okay. Now, the second important learning topic that we have to discuss here is how radiologists write the reports. We have to understand how they make the report so that we know how to decide. There are certain things on how radiologists or ultrasonographers write the reports that I have learned throughout the years. Natuto ko lang yan, napag-aralan pa yan throughout the years because of experience that I take note of when I read and interpret the reports. Okay. So this helped me in deciding what to do when I cannot accept their conclusions wholeheartedly. So the implication here is that yung reports na binibigay ng radiologists and ultrasonographers are not yet final. Kaya meron siyang caveat yun. This has to be discussed with your attending. Okay? So it's the attending who will make the final decision. So one idiosyncrasy or one practicing habit or something that's peculiar with the region and how radiologists make the report is that we have to accept that there are a lot of subjectivity, okay, in the reports of the radiologists in both mammogram and sonogram or ultrasound. As a result, there are a lot of inter-observer, okay, between two observer variations, meaning given the same mammogram and ultrasound plates, placa, two different readers, two different radiologists will read and interpret them differently. Okay. If I have a BI-RADS 4, example, if I have a BI-RADS 4 suspicious for abnormality report, but in the absence of a palpable dominant mass, wala akong nakakapangbukol, if I have the imaging done in another institution, another center, and read by a different reader, most of the time, from my experience, I got a BI-RADS conclusion of less than 4. Okay, 4 is suspicion. So less than 4, such as BI-RADS 3, probably benign, and even BI-RADS 2, negative benign, dapat benign ito. Then BI-RADS 1, benign. Okay, or negative findings. Okay, sorry for that typo. Okay. Another idiosyncrasy is that usually radiologists would like a combination of ultrasound and mammo done for all patients in order for them to make a BI-RADS conclusion. However, usually in patients with ultrasound alone, if you have ultrasound alone, they usually make a commitment on the BI-RADS. Okay? Usually in patients with mammo alone, without ultrasound, radiologists commonly will not commit a BI-RADS conclusion. They usually place a BI-RADS 0, which means additional exam. Usually, they would like to have an ultrasound done. So this is the common practice of radiologists that I take note of. Okay? But in my opinion, in reality, the radiologist can commit to a BI-RADS conclusion just based on the findings of the mammogram plates. Okay? This is my personal opinion. Okay? From my experience. Okay, so if there is no clue for or signals for malignancy, such as cluster of microcalcification, I just told you earlier that this is a very significant cue for cancer on the mammogram, cluster of microcalcification. Pag nilagay no, pag nakalagay doon, no cluster of microcalcification seen, it's tantamount to a conclusion already. Okay. Depending on the presence of other findings but which are not cues for malignancy, the conclusion could be, okay, kung walang cluster of microcalcifications, baka may nakitang density, usually it should be negative findings, okay, BI-RADS 1, BI-RADS 2, benign findings, BI-RADS 3, probably benign, okay. Usually doon din lumalabas sa ultrasound reports. Okay. The third idiosyncrasy is that the increase in the size of the mass alone on ultrasound is commonly used as a basis for BI-RADS conclusion. I have observed this also. I don't fully subscribe to this. I have to look at other data on the ultrasound like ill-defined border and other data on physical examination before I accept the BI-RADS 4 conclusion. Another idiosyncrasy radiologists commonly use the word mass, nodules in their reports. So usually on mammogram, an unusual white or dirty white or whitish density is usually considered as a mass or nodule. Okay, such as shown here. Medyo grayish ito, puti, na ito yung mga calcifications. Okay. On ultrasound naman, the sound waves that produces a hypoechoic, yung konti lang yung shadows, okay, is usually considered as a mass or nodules. Okay. However, not all masses or nodules reported on ultrasound and mammogram are real space-occupying or three-dimensional masses or nodules. Some or a lot of them will turn out to be fibrous tissues. Okay. This is rarely reported by the radiologists, okay, fibrous tissues. But if you look at the internet, there are a lot of reports coming out now. Okay, we have to distinguish real mass from fibrous tissues. Okay, if the reported masses or nodules is of a size that can usually be palpable, okay, and if these masses or nodules are really palpable, then I would accept the report of the presence of the mass. So kung ang report sinabi sa may nodules, pagkatapos may nakakapa akong nodules, okay, that's it. May mass talaga. But if there are no palpable nodules, okay, even if the reported size that can be naka-report doon is more than 1 centimeter, then I put a hold order. Sandali. Okay, hold order on my acceptance of the report. I will re-evaluate further and make a decision whether to repeat the diagnostic test or not. Okay, so kung walang bukol at meron kang mga alarming reports, now then I scrutinize further and then probably make a decision not to accept it as is yet. The fifth idiosyncrasy is that radiologists usually put recommendations after their conclusions. So examples of recommendations are tissue biopsy recommended, follow-up ultrasound and mammography after 6 months or 1 year, etc., etc. Okay. My recommendation, this is my personal recommendation, is just to consider them, yung mga recommendation ng mga radiologists, as personal recommendations. Okay, so we cannot stop them from giving their personal recommendation. They can write anything they want to write there. Okay, one does not have to follow them. You just let your breast specialist decide on what to do next. This breast specialist may not also follow the recommendations of the radiologist, but some breast specialists, especially those ritualistic, yung sinasabi kong ritualistic report, and maximalist physicians, breast specialists, they usually follow the radiologist's report. Okay. Now, as to the common challenges being encountered in those reports, I will present you some illustrations. Patient number 1 with a report of Byron's 5, and there's a palpable breast mass with ill-defined border. Okay. So ang ultrasound report runs like this. Okay. So there is a solid irregular mass, okay, solid irregular with indistinct margin, okay, and then measuring about 1.9 centimeter in its largest diameter, okay. So if there's a report like this, medyo okay to, because this is really suspicious, no? Okay, so 1.9 is palpable, solid on ultrasound, indistinct margin, okay. So with that, we suspect breast cancer already, okay? Now, after that, nagpamamo siya, okay? So lumabas, speculated mass on mammography, okay? Ito yun, speculation, okay? So pag meron ka nito, talagang mataas yung highly suggestive for malignancy. So this one, I will accept, okay? So in the presence of a palpable solid breast mass with ill-defined border, accept or agree with the results of the ultrasound and mammogram, which is Byron's 5. Okay? So kung minsan meron kang mga other findings like simple cyst, pag simple cyst, benign siya. Okay? Doon sa left breast. And then dito naman may solid mass pero distinct siya, usually benign siya. Okay? So you don't have to do anything about this, no? Okay. So we just focus on the breast cancer itself. Second illustration, may report na BI-RADS 4 and then BI-RADS 3 and BI-RADS 2. Ito yung mga tinatawag na roller coaster, no? In which I usually ask them to repeat, okay? And then the patient has no palpable breast mass, okay? So I will expound on this more. So this patient, 66-year-old female today, okay, 2022, okay. In 2016, she was given a BI-RADS 4B, okay, which is mas mataas sa 4A, okay. A moderate suspicion, okay. In Hospital A, I won't mention the name, but they just put it Hospital A. So in 2016, May, so 1 month after, 1 week, 16, and 1 week after, I asked for a repeat ultrasound in Hospital B, another hospital. So it turned out to be BI-RADS 2, okay, from 4B, naging 2, okay. Then follow up ultrasound on her own, pumunta siya, she's not yet at ease with the findings. Nagpagawa siya ulit ng ultrasound sa Hospital A. Balik siya sa Hospital A, October 20, 2016. Lumabas na naman 4B. Okay? 4B. Okay? Same report as the first one, May 16 and then October 20. Then we had the repeat ultrasound done in another center, the Hospital B again. When she showed me the results, sabi ko, bakit ka nagpagawa doon? Because kung nagpagawa ka doon, they will insist on their tama sila, no? Okay, so I had it repeated again in Hospital B, October 24, 4 days after, BI-RADS 2 na naman, okay? So may roller coaster from BI-RADS 4B, BI-RADS 2, BI-RADS 4B, BI-RADS 2, okay? Now in 2017, of course, we have to follow after the initial evaluation. My policy is that we have to observe the patient. So in 2017, may follow-up, nagpa-ultrasound siya, balik siya sa Hospital A, okay? Binasahan naman siya ulit ng 4B, okay? Then I had the ultrasound repeated again in Hospital B, ang lumabas 2 naman, ulit 2, okay? And then, sige, para to settle the issue, sige, paggawa natin sa Hospital C, okay, in August. So lumabas BI-RADS 3. So you can see BI-RADS 4B, first Hospital A, then Hospital B, BI-RADS 2, then Hospital C, BI-RADS 3. So since then, pupunta na siya na lang sa Hospital C. Okay, so 2018, 2019, annual follow-up ultrasounds has persistently showed BI-RADS 3. Okay, so lately, last 2 weeks ago, she had a checkup with me, so wala kaming nakikitang abnormal findings. So normal pa rin, walang bukol. Okay, so this was 2016, 2022, 6 years after. There is no mass to indicate the cancer, cancer. Kasi kung may bukol siya 2016 na cancer, lalabas yan. No? So that's the radiologic diagnosis of BI-RADS 4B was really wrong. Okay, so patient did not undergo any form of breast operations. Okay, so this is a sample of the test that was given to her, BI-RADS 4B. Okay, so sinasabi solid mass with suspicious sonographic feature, right? Tissue correlation suggested. So which I did not do also as a clinician. Okay, so sinasuggest needle wire localization and percutaneous core biopsy under sonographic guidance may be done. Okay, so here I did not do this. I saved her from the operation. Axillary node with suspicious sonographic features, right? Tissue correlation is also recommended. Okay, so the others are benign. Okay, so this is sonogram 4B, and then pinagawa namin sa another hospital. I suppose this is the Hospital C. Lumabas naman BI-RADS 3, probably benign. Okay. So all this report shows circumscribed, distinct ito. This is same as circumscribed mean distinct. Okay. Okay. Yung cluster of cysts naging may mga cysts na siya ngayon. Okay. And then there's non-visualization, okay, of the findings before. Okay. So unenlarged and fat-laden lymph nodes were normal already. Okay. Okay. So you can see the roller coaster that this patient underwent by BI-RADS 4B, by BI-RADS 3, by BI-RADS 2. Okay. So 6 years after, wala na siyang cancer. Okay. Another illustration, patients number 3, gotten a report of BI-RADS 3, and then pinaulit ko BI-RADS 3, and then on her own, ayaw niya maniwala, nagpagawa siya ulit BI-RADS 1. Okay, so there was no palpable mass to start with. Okay, so this is the the report given to her. Yung first report, okay, this is 4A. Okay, so because what was shown, what was reported here, solid, irregular, okay, nodule at 12:1 on the left breast. The recommendation is tissue correlation is recommended. Okay, so at yun. So this is number 2. Usually there's maraming nodules. You have to distinguish which one is the you suspect. Okay, usually yung pinakamalaki 1.2. Okay, so ang initial reading here was 4B. So I asked for a repeat because I was not able to palpate any mass. So repeat shows this time BI-RADS 3, probably benign. So ito yung mga description of the masses. Okay, solid, avascular, etc., etc. No suspicious ultrasound findings are evident on the right breast. Okay. So pinaulit niya, gusto niya talagang sigurado, she went to another hospital. Okay, this time it shows her BI-RADS 1. When you say BI-RADS 1, it's normal ultrasound. Okay, so a BI-RADS 4 can eventually be BI-RADS 3, BI-RADS 2, BI-RADS 1. Okay, iba-iba. So illustration number 4, patients presenting with a multiple nodule. I'll just discuss the challenges that sometimes that I encounter with the reports. This is actually inadequate reporting. Okay, so here is the report. This one is a 42-year-old female presenting with the right breast mass in the 6 o'clock position. Okay, from examination, it looks benign. Okay, so but since I did it under telemedical consultation, I told her, why don't you just have an ultrasound done so that I can really measure the mass? Kung benign siya, if it's more than 2 centimeters, then I will recommend an operation, removal. If it's less than 2 centimeters, ano na lang, observe na lang. Okay? So, pina-ultrasound ko, ang lumabas ang report like this, which I was really disappointed. Okay? Nilalagay lang nito, there are multiple nodules noted on all quadrants of both breasts with a mean diameter of 10 to 19 millimeters. Okay, so benign naman sila lahat, hypoechoic, no? Okay, circumscribed margin. Ang diagnosis ko rito is fibroadenoma, which is a benign. But my concern here, anong size ba yung bukol? Okay, yung bukol na nakikita. No? Kasi nilalagay dito, when you say mean diameter, may range yan, di ba? So it can range from, kung mean diameter is 10.1 centimeter, okay? So it can range from 1, 2, 2, 2, or 3, di ba? So which one? No? So yan ang kumisan, yan ang disappointment, frustrations natin with the reports. So the clinicians will have to know how to interpret and how to call the attention of the radiologist, no? So I have to tell the radiologist, I order for an ultrasound for you to help me, okay, in making a description of the masses. Pero ang description mo medyo malabo, di ba? Okay. So anong size ba yung nakikita natin dun sa left, sa right breast? Na? Okay. So I asked the patient to go back to the radiologist and ask for more detailed description. So mas maganda yung ganito. Diba? Kung may report na 12 o'clock, itong size, itong size, itong size. Ganun. Na? Mas maganda. Na? Okay. So I still have a lot of examples and patients that I can share with you on the challenges on breast ultrasound and mammogram. Let me stop here on the examples, but I have invited some patients of mine to share their experiences with you later on. I hope they can share. Okay. At this point, let me share with you a legacy that I want to leave behind before I die. With my approach of reading and interpreting ultrasound and mammo, particularly combined with meticulous palpation, kinakapa ko talaga yung breast, okay? I have saved more than 50 women from unnecessary breast operations. This is the least number because I just started counting on June 2012. I've been in practice for the past 40 years, okay? So all this data are written in this URL. It's in my blog, okay? So may mga BI-REDs, probably among the 50, those with I have saved about more than 30 with BI-REDs 4 na hindi kailangan operasyon. The rest of the 20, usually may mga macro cyst na ina-aspirate ko lang na hindi na kailangan operahan. No? So I also have a batting average, okay, of 98% of correct diagnosis using the following as indicated. Ito yung mga strategies na ginagawa ko. History with focus on physical examination, okay. Ultrasound and mammogram, okay, as needed, okay. But rarely I don't usually use CT scan and MRI kung kailangan lang. Okay. Watchful waiting and follow up and check up with focus on physical examination. Ito importante para kung may konting uncertainty on the first or second consultation, I can correct it right away. Kaya lumalabas in the end, 98% correct diagnosis ang aking batting average. Okay. So my advice with the including some summary and takeaway before we end. Okay, I've discussed all of these things, general recommendations, how I read and interpret breast ultrasound and mammogram, common practice of the radiologist, examples of challenges, and then my advice in interpreting breast ultrasound, which I'm going to now in details. So, although the reports are written for healthcare professionals and not patients, there is a lot that you can learn by looking, studying, and learning from them, especially in this pep talk. Okay, so I don't know if there are other doctors doing the same thing, talking to you like this, okay? In the end, however, always have a trusted breast specialist, clinicians, read and interpret for you. Okay. Learn how to palpate your own breast. It's very, very important. Okay. Do regular breast examination, self-examination. You may not need ultrasound and mammo if you do regular breast self-examination, okay? And then sometimes breast self-examination can catch your breast cancer early enough compared to ultrasound and mammo, since you don't do your mammo every day, every month, okay? During the intervals of yearly, okay, once every 2 years, baka lumalabas ng breast cancer doon. So if you do it, your breast examination on a monthly basis, madidiscovery mo kagad. Okay? Do diagnostic tests only when indicated. So these are the indications that for the ultrasound and mammo. So you screen, okay, but you do it only in high-risk patients. Not everybody should have all the lab tests done. You want to have a more definite diagnosis after clinical evaluations. Sabi natin, di mo sigurado kung ano, then I have to do the ultrasound and mammo. Then to determine the severity and the outcome, and then to monitor the progress of disease and treatment. So these are the basic 4 indications for any lab test, including mammogram and ultrasound. So if you do diagnostic tests outside the indications, which are commonly done, you will end up with a lot of false positive, alarming readings which can cause undue anxiety, which may lead to other unnecessary tests like biopsy, okay, which may lead to unnecessary operations, not to say expenses. If you have an ultrasound and mammogram done, remember these things. Remember, BI-RADS 4 or even 5 may eventually turn out to be BI-RADS 3 or even 2 or even 1. Okay? So hindi siya final. Okay? So just have a trusted breast specialist to review and interpret and do the clinical correlation. Remember also, if you have a BI-RADS 3, 2, and 1, 1, again, it's negative findings, 2 is benign, probably benign, okay? So it may be false negative, baka mali, okay? Especially if you have a palpable breast mass. So importante yung kinakapa pa rin ng specialist. So just have a trusted breast specialist to review and interpret and do the clinical correlation. No, not all masses reported on the ultrasound and mammogram are real mass. Remember that, okay? If they are not palpable, they may just be fibrous tissue, part of the fibrocystic changes, okay, which are part of hormonal changes which you don't have to do anything about. Pero nakakatakot kasi of the words mass being used by the radiologists. So if cysts are reported, okay, 99% of the time, they are benign. And again, they are part of the fibrocystic changes. Note the word cystic here and the fibrocystic word. Okay. So, this is also being reported in the literature. Okay. So for those of you who are attending now, if you have BI-RADS 4, be consoled by this statement. The most common finding in BI-RADS category 4 is breast fibrocystic changes. And fibrocystic changes is a normal breast condition. Okay, but just the same, consult the breast specialist on what to do next. At the end of the day, have a trusted breast specialist to review and interpret to do the clinical evaluation correlation. And when I say, you will ask me, who is the breast specialist? It is the breast specialist is a general surgeon who specializes in breast disorders. So that's currently the people doing this this kind of a task. Okay, it's not the OBGYN because they don't have much training on the breast. Okay. So after hearing the explanation and recommendations on what to do next by your attending physician, feel free to ask questions as needed for further clarifications. The decision on what to do next should be a shared one between you and your attending physicians. And if there's a need for a second opinion for another physician on the conclusion and recommendations on what to do next, go ahead. You have the right to a second opinion. This is part of the patient empowerment. Knowing the principles and processes of reading and interpreting lab tests like ultrasounds and mammo and their associated caveats, warnings, like I've given you, is also part of patient empowerment. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on how physicians read and interpret breast ultrasound and mammogram. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of yourself by having some idea on how physicians read and interpret breast ultrasound and mammogram. So with this, I end my pep talk. I hope I have empowered you to have a better understanding of the importance of reading and interpreting breast ultrasound and mammogram results in your health management. As a reminder, before we go to the question and answer portion, please take the OLETE, and then please pass the OLETE exams, the test, so that you can have a certificate. Try to accumulate 50. And then, as a request, again, please type in your feedback on the chat box during the open forum. We now have the picture taking before the question and answer portion. Please show your face now. Okay. Get set. Ready. 1, 2, 3. Okay, I'll just save it first. Okay. Okay, the floor is now open for comments, questions, consultations. As I said, if you have an ultrasound report with you, if you want to consult me, go ahead. Okay. I told you I invited somebody, okay, to share their experience. Emily, just Emily. Okay, Emily, can you share your experience? Yung experience, Emily, somewhat on the other extreme, huh? Okay. Yeah,
Okay.
very rare yung sa kanya eh. Okay.
Good afternoon. I'm Emily Alba, 53 years old. I will be sharing with you the issue I experienced with my breast. In July 2018, I consulted Dr. ROJoson for a lump I felt in my right breast. It was a big lump that even caused a slight retraction of my nipple. It was also during that time when I was having missed monthly periods. I was surprised because I have been regularly doing mammography and breast ultrasound for many years already because of the small solid nodules I have in my both breasts, but they were all benign. Dr. ROJoson examined me physically and was convinced that there was really a big lump. So he requested me to have an ultrasound of my breast. The results showed benign, small, solid nodules only, but no big lump. I saw in Dr. ROJoson's face that he was wondering how come there was no lump in my ultrasound result, but it was very obvious that there was really a big one. He even asked me to lie down again that day for the second time to examine me and even got a ruler to measure how big the lump was. Since Dr. ROJoson was not convinced with the result, he ordered me to have another ultrasound with a different laboratory. Again, the result showed the same as the first one, no big lump. Finally, he decided that I should undergo a more advanced test, which was an MRI. But still, it showed the same result, no big lump. He also biopsied the area of supposedly lump to rule out malignancy. He did not operate me and concluded that there was really no big lump, but just a fibrocystic change, possibly due to lack of estrogen as I was approaching menopause that time. Little by little, the supposed lump has softened and feels normal again. That's all.
Okay. Thank you. Thank you for sharing. No? So, yun sa kanya extreme, yung ano, may nakakapa, malaking malaki, pero benign pa rin siya. Di ba? So, it just illustrates that maraming uncertainties in medicine, in the patient's body. Importante yung close analysis, constant analysis, and follow-up by the doctor. No? Okay. So we don't usually jump to the right away operate. No? Okay. Observe lang. Okay. Okay. Any more
Doc,
questions?
can I say something, Doc?
Oh, Susan, yeah, I heard you.
Yeah, I'm Susan. I was your patient in year 2017 or 2018. And I think it's the same observation, it's the similar, no? There was a BIRADS 3 or 4, and then you were not convinced by what the radiologist here in Makati did in the report. And what you did was you requested for a biopsy, but the biopsy, the results will be interpreted or read by your, I think it's Manila doctors, no? And
Mhm.
what you did is needle
Yeah.
biopsy. Medyo
Yeah.
masakit, but kayang-kaya, but it was better than going to an operating room to remove something. Fortunately, you told me that it was fibrocystic. Actually, all my findings, even you and the doctors several years after who saw cysts in my breast said that fibrocystic. Now later, just this year, no, there was an incident that I had experienced pain in my left breast again. It's always the left breast, and more than that, it swelled. No, there was a swelling. So I went to my doctor here in Makati sa HMI. I went to an OB-GYN, and then she said that I undergo ultrasound, and then show it to I showed it to a friend of hers who is a surgeon, and he said that it was fibrocystic, and yun daw masakit was mastitis.
Yeah.
So now I want to ask that if I had those findings always fibrocystic, will it be will I be okay, what do I say? Hindi na ako I won't be anxious anymore, because anyway for several times it's always fibrocystic. Or do I
Okay.
have to undergo yearly a mammogram?
As I said, you don't have to as long as you do your regular breast self-examination. Yan ang pinaka-simple, di ba? Kapa-kapain mo lang yung breast mo, no? So you have this experience of focus attention on your breast for the past 5 years, 6 years. Dapat expert
Yes,
ka na.
6 years. Yeah.
Expert ka na doon sa breast mo, kinakapa-kapa mo na, no? Okay? You can just do your regular breast self-examination, okay, on a monthly basis, and then just monitor, okay? So it will not stop anything from coming out there, breast cancer. Just like ganun din sa kahit na magpamamo ka, ultrasound, it will not stop the breast cancer from appearing. Kung talagang lalabas, lalabas. Bantayan mo lang, no? So we will never know what will happen in the future. Okay, sana wala, no? Okay, but when you have a diagnosis of fibrocystic, it doesn't mean cancer. Okay, it doesn't mean that it will lead to cancer also. Okay, so if there's a cancer appearing, it's something new, something na binigay sa iyo, somebody gave it to you. Okay, okay, so bantayan mo lang, but at the moment everything is normal, no? Okay. Yung pain, don't worry about the pain. Usually there's a pain, and kasi when say fibrocystic changes, it's usually hormonal related changes, no? So usually when you have hormonal related changes, usually may konting kirot-kirot, discomfort, but it's usually transient lang siya. Nawawala siya, no? Okay.
How did it relate to mastitis? Why did I also have mastitis?
I don't know. Mapula ba? Mapula?
Before, pero binigyan ako ng antibiotics, nawala na.
Okay, kung may mapula, I would accept baka nagkaroon ka ng mastitis, no? Basta may mapula. Pag walang mapula, usually fibrocystic lang 'yon. Okay.
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 Okay. Sige, thank you, Doc.
You're welcome. Okay. Okay. Any more comments? Abet, I'm not looking at
Nothing at the chat box.
Oh, meron.
Where? From Chris Nisea, the Ilang beses ba need magpamammogram per year po? Lalo na pag may need ay observe po.
Kung wala kang high risk for breast cancer, no, significant high risk, you actually don't have to have mammogram, no, okay, or ultrasound. Just palpate your breast. Yan ang pinaka-minimum. Palpate your breast on a regular basis. Libre naman yung palpation na yun, no? Okay. But if you are at risk of breast cancer, okay, so probably depending on your age, depending on how talagang how high is the risk, kasi kung may dalawang family members with breast cancer, no, mother, sister, mataas ang risk mo. Kung isa lang, mas mababa, no? So the interval will be lesser, no? So you can have mammogram after age 50. Ang recommendation actually abroad is that for high risk, age 50 and above. Pero in the Philippines, 40 ginagawa na, okay? Okay, hindi pa napapalitan yung recommendation na yun, no? Okay. So in the States, some would now compromise, baka 45 na lang. Humihingi ng tawad 45 rather than 50, no? Okay. And then after that, when you reach 79, 75, hindi na kailangan, no? Ganon, no? So it all depends, no? So, but if you have a history of breast cancer, no, so you may have to do it more frequently. Okay.
Okay, there is another one. Follow-up niya. Need po ba sabay ang ultrasound and mammography?
As I said in my lecture, ang ginagawa ng radiologists, not majority, because I've experienced before when I order for an ultrasound, ayaw gawin, sabihin nila, dapat may mammography sabay. Ang aking reaction is bakit? Gusto niyong kumita? Ganon? Okay, kasi doble, di ba? Okay, pero they always reason out that we cannot make any conclusion kung wala yung isa, no? But in my explanation kanina in my lecture, sabi ko kanina, actually you can conclude already, no? Pag nilagay niya sa mammography, no cluster, no signs of, no signals for breast cancer, yun na yun. Okay na yun, no? Okay. Then you don't need the ultrasound anymore. Okay. So pwedeng wala sa akin, ha? Okay. In fact, personally, I would put more importance on ultrasound, no? Okay. Kasi mas maraming may conclusion yung ultrasound kaysa mammo. Mammo palagi sinasabi, needs additional, no? Okay.
Doctor, I have a question. Kanina kasi may sinabi ka dun sa breast na calcification. What is a calcification and what causes calcification?
Calcium deposits yun, mga calcifications. It has been found that pag mga breast cancer, in 30% of cases, hindi naman lahat, ha? 30% lang naman ng breast cancer, may konting deposits, calcium deposits, no? Kaya yan ang ginagawa nilang basis for suspecting breast cancer, no? But it has to be a type of, yung pattern should be, kumpul-kumpul siya, hindi pwede yung sabog, okay? Yung sabog na yon, normal yon, no? Kasi katawan natin maraming, as we age, maraming calcific deposit na yun, di ba, sa katawan natin, no? Pero pag kumpul-kumpul yan, kaya they call it cluster of micro, yung mga maliliit, no? Then you suspect cancer. Okay. Pero 30% lang yon. Okay. Any more?
Thank you.
Who wants to share their experience?
Doctor, may question dito. Doc, my last ultrasound is October 28, 2021. The impression is solid breast nodules, right, by RAD3. Do I need to have follow-up ultrasound and mammo? This came from Dilette.
Milet del Rosario. Okay. I would just assume, okay, based on this, what you present to me, yung sinasabi, okay, ganun na lang. Kasi kilala kita Belet, no? Kasi I was thinking yung may background ka, may story ka, no? Sabihin natin wala kang history, okay?
Yes.
Sabihin natin wala kang history, okay? Wala kang history of breast cancer. And then you have this ultrasound that showed the solid breast nodule by REDS 3, okay? So yung, kaya nga, importante yung yung clinician like me, okay? Ano ba yung nodules na yun? Is it really buccal? Okay? O baka fibrous tissues lang yon. Okay? Kung fibrous tissues lang yan, it's fibrocystic changes. It's normal. Okay? Then, gaano kalaki ba yung bukol na sinabi sa'yo? So, may S, di ba? Solid nodules, marami. Na?
Marami.
Okay. Gaano kalaki? Gaano kalaki yun? Baka less than 1 centimeter. Pag less than 1 centimeter, usually 5.
Less than 1 cm po.
Less than 1 centimeter. Okay. Basta less than 1 centimeter sa akin, usually mga fibrous tissues lang yan. But they report it as a mass, the nodules. Na yan ang sinasabi ko. No? Okay. So, fibrocystic ang aking diagnosis. You can see that I can give you a very specific diagnosis. Kasi pag sinabing nodules lang, hindi, sasabihin lang may bukol. Hindi mo alam kung ano siya. Diba? And then by REDS 3, sasabihin niya, benign lang. Diba? Okay, probably benign. Pero ako, sasabihin ko sa'yo, it's fibrocystic changes. Very definite ako. Okay? So, then when you say fibrocystic changes, it's normal. You don't have to do anything. Okay? Okay, so you don't have to do a follow-up anymore. You just palpate your breast. No? Okay?
Meron nga akong nakikita po na parang masakit-sakit, na parang may yung fibrous. Nga ho.
Okay. Kaya matakot sa sakit. Mas maganda kung may sakit at walang bukol. It's fibrocystic. Okay? Mas nakakatakot yung bukol na walang sakit.
Ganun talaga.
Okay? Yung bukol, yung talagang bukol. Ha? Yung nakakatang bukol na may sakit. Ha? Yan ang nakakatakot. Ay, yung walang sakit. Ha? Yung may bukol na walang sakit, yan ang nakakatakot.
Pero pag parang may bukol na masakit.
Pag may bukol na masakit, pwedeng ano yan, baka breast abscess. Na? Baka may naga sa loob. Na? O kaya may yung tinatawag ng macrocyst, malaking cyst na may tubig, kaya nagdi-distend, kaya masakit. Okay? Pero breast cancer itself, from the very start, no, hindi siya masakit. Breast cancer hindi masakit. Pag kinain na yung balat mo at pumutok na sa balat mo, that's the time na masakit.
Ganun po ba?
Yun lang. Ha? Kaya wag na ibabaliwala yung mga bukol sa breast na walang sakit. Ha? Yan ang mas delikado.
Okay po. Thank you po, Doc.
Okay?
Another question from Wen Villajos. Doc, if stated in the ultrasound the complex nodule at 11A position measuring 3.1 by 1.5 by 4.0 tissue, correlation is suggested by REDS category 4.
Complex, okay. Complex nodule at 11 position. Now, when you say complex, it's a combination of cyst, may fluid, may solid. Okay? So, usually benign siya. Okay? Basta may pag solid, mas 50-50 lang kung pag solid. Pero pag sinabing cystic nodule, 99% benign. Pag complex, probably 90% benign pa rin yan. No? Okay? So, 3.1 or 4 centimeter, largest diameter. So it depends. Nag-BI-REDS 4 ka, BI-REDS 4 nilagay sa'yo.
Coming from Doc sa St. Luke's Breast, what you call that, center, that was November last year. Nung hindi ko pwede makipag face-to-face. So, I tried to other hospitals. So, yun po yung results. Ano siya, Doc? It's an ultrasound mammogram.
Okay. Kinompare niya yung dati mo?
Yes, Doc. I always both naman may ultrasound previous in
Anong basis for saying Byrad's 4?
I don't know, Doc. Hindi na ako bumalik doon sa breast specialists. That's why I'm going to see you on Wednesday.
Okay. Sige, dapat makapako at I know you because you have a history of fibroadenoma. Most likely it's benign. Okay.
Doc, kasi you've been handling my my case for more than 15 years na ata, I think.
Kaya nga, I know. Sabi ko, I know you.
Yeah, oo. Ako lang naman nag-insist to remove the cyst but hindi mo advisable kasi baka hindi approve ng HMO but malalaman natin yan by Wednesday. To be honest, girls, meron akong breast cyst since I was 17 but now I'm 45. Si kay Doc Holson ako nagtagal and he doesn't suggest in operation. Ako lang talagang makulit. Bumabalik siya.
Okay. Yung kay Weng, meron siyang fibroadenoma. Fibroadenoma sa kanya. Kung bata ka, fibroadenoma. Hindi talaga may bukol. No? Pero minsan umuulit yan talaga. No? So, kaysa tanggalin lahat, hintayin mo na mag-menopause ka na. Pag nag-menopause,
Dok, malayo pa ata yan. 45 lang ako. Maaga ba ang menopausal stage ng babae ngayon?
kung minsan, di ba, may 45. Only God knows kung kailan ka mag-menopause. No? Okay. Basta babantayan lang. No? Okay. Tsaka mabagal naman lumaki yan eh. Di ba?
Kasi mahirap ang single, Doc. Di kaya yun yung case ko dahil single ako, walang nahawa. Kaya walang
It doesn't apply kung single or ano ka. Okay? Walang kinalaman doon. May mga may mga tadhana mo na lang yan. Okay. So anyway, don't worry, I'll see you i-examine kita. Examinin kita. Pero malaking chance na benign, no? And then I have to see kung anong basis ng radiologist, no? Bakit sinabi niyan 4, no?
Medyo worried lang ako, Doc, kasi my aunt was died because of breast cancer. Kaya nakakabahala din.
Yeah, that could be. That could be, no? Kasi meron kang, the moment you have Byrad's 4, nakakatakot na. Okay? What more if you have relatives na may who died of breast cancer, lalo ka matatakot, anxious ka na. Okay? So, okay. Any more?
Yeah, from Jocelyn P. If in the ultrasound conclusion, an enlarged bilateral axillary lymph nodes, does it mean free from cancer?
It just mean negative, no? Okay? But if yung sa breast mo, dapat wala rin. No? Kasi axillary lymph nodes, kilikili yun, di ba? Okay. And then, sa breast mismo, kung walang bukol, so usually normal yon, wala na. No? Okay. Okay. Dapat i-combine yung dalawa. No? But you can have a breast cancer with negative axillary lymph nodes. No? Ibig sabihin, hindi pa makalat doon. Okay? Ganon. So,
thank you, Doc.
okay.
Okay.
Walang guarantee, it's free of cancer.
Yes.
Okay.
Thank you.
Okay. Ano
Okay.
pa?
Yeah, from Chris Nesesia. Doc, pag may history ka ba of breast cancer sa left breast mo, malaki po ba ang chance na magkakaroon din po sa kabilang breast?
At sa ngayon, maliit lang. Okay, that's why yung may lecture tayo last time, low value operations, no? Yung removal, double mastectomy, yung removal of the other breast is a low value operation. They don't recommend kasi mababa lang ang incidence na pupunta sa kabila, no? Okay? But if you have yung mga genetic tests, yung mga tinatawag BRCA, BRCA1, 2, ganon, no? Okay? So parang yung mga sa US, no, yung mga Jewish population, mataas ang may genes sila doon, then that's the time you can do double mastectomy kung mataas ang risk mo. No? Pero in the Philippines, bihira yung mga 5% lang yung mga genetic predisposition natin sa Pilipinas. No? So usually not recommended. No? Okay. Because of the low risk. When you say low risk, doesn't guarantee na hindi uulit. Pwede pa rin umulit, pero bihira. Ang unang, ang pinaka-main problem mo is the original one. Yung original one mo, on that side, yun ang kakalat, yung kumakalat, yan ang nakakamatay. No? Okay. Not on the other side. No? Pag may tumubo on the other side, it's a new one. So basta mahuli mo lang maaga, pwede na yun. No? Gumutin mo lang. No? Maganda ang chance. No? Okay, any more?
Yeah, there is a follow-up question from her. Ano po ba ang capitalized BRCA tests po? BRCA test.
It's a genetic test, BRCA. Nasaan ba yun? Nasaan?
BRCA test.
Ano ba ang BRCA test? Okay. So, yung genetic test yan, breast, something like breast cancer genetic test, no? Okay. May 1 and 2 yan eh, no? Ganon, no? So, I don't know whether it's being, baka meron na sa Pilipinas. Bakit mo gustong gawin yon? Bihirang-bihira naman yan. No? Okay.
Okay, from Angelina Tanyola. Doc,
Okay.
is it okay to take medicines rather than chemotherapy? Yan, I have a friend who is a cancer survivor.
Does it okay to take medicine rather? Chemotherapy is also a medicine, no? Okay. So just like anything else, we must know the indications, no? Kung bakit kailangan uminom ng gamot, kailangan mag-take ng gamot, no? So I don't know when you say take medicine rather than chemo, you're talking about oral tablet. Baka oral tablet ang tinutukoy mo. Baka yung oral tablet or the tama?
Oral po. Opo, oral tablet.
So baka oral tablet, no? Yung mga hormonal therapy yon, mga tamoxifen, no, ganon, no, yun, no. So that's another form of parang drugs that will try to prevent cancer recurrence, no. Okay. Okay. So may indications doon. Kung ang indications mo ay yung tinatawag na may estrogen receptor assay, progesterone receptor assay, kung positive, pwede mong inumin, no? Okay? At pwede mong inumin kung medyo advanced yung breast cancer mo. Sabihin natin may lymph nodes positive, then that's time you take. Kung negative na yung lymph nodes mo, you don't have to take it. Pwedeng hindi ka uminom ng gamot, mag-chemotherapy, no? Okay? So it all boils down to indications. Always consider the diagnosis first, kung anong status, anong extent, kung early stage, no, late stage, no, and then number 2, yung indications. Kailangan ba o hindi, no? Ganon, no? Okay.
Okay, I forgot to read this from Weng Villajos. Nararamdaman ko pain sa likod. Does it mean ba na bumibigat na yung right breast ko?
Maraming possible causes. You try to identify it na lang, na? Okay? Kung wala namang indications that you're dealing with mastitis, na infection sa breast, no? And then just hormonal changes, no? Usually, kuminsan tumatagos din sa likod, kuminsan, pero bihirang-bihira. Pero there are other causes for that. Baka yung position mo, palaging nakayuko, no? Okay? Wala kang exercise, no? So, try to eliminate them first, no? Okay? Okay?
Okay. There is a comment from Susan Argel. Doc, you enlightened me with your session. Now I feel relieved with your explanations.
Thank you. You're welcome. Okay. So, anyone who wants to share last call before we end? It's 3:26 already.
Dr. si baby, di ba ilang beses na yan na-aspirate?
Konti lang. Ilang beses ba na-aspirate, baby? Once? Baby?
Doc, Mag-share lang ako.
Oh, sige, share.
Yung, yung sa breast ko, since 1997, patients mo ko, fibrocystic. Ang ginawa mo lang sa akin, biopsy, benign. So, nagpapasalamat ako hanggang sa nawala na yung bukol. Hindi mo naman ako pina-ultrasound at mammogram.
Okay. So, iba-iba yung gamutan. Iba-iba yung gamutan ng pasyente. Okay? Depende sa sitwasyon. Okay?
Aha.
So, basta bottom line is a trusted physician who analyze things, no? Wag yung
Aha.
yung tinatawag na ritualistic, gawa ng gawa kahit na impulsive lang, no? Okay? Yung nag-a-analyze, no? Okay. Yan lang masasabi ko. Trusted physician, and then who uses yung patient management process na tinuro ko sa inyo, no? Okay. Okay. So if there
Pag ganun, Doc, nag-menopause, hindi na umuulit?
kadalasan hindi na.
Sige. Maraming salamat, Doktor.
You're welcome. Okay. So if there are no more questions, okay, we'll call it a day unless you can PM me for any questions that you may have after this. Kung di tayo, we don't have time anymore, no? Okay. And then next time we will be talking about thyroid function test naman, thyroid. Very common kasi yun eh. Mga thyroid function test, saka yung ultrasound of the thyroid. No? Okay. So ngayon, nakikita ko maraming, kasi yung BI-RADS yan, nag-umpisa sa breast. No? Ngayon, ginagaya nila yung sa breast, yung thyroids naman sa thyroid. No? Okay. Pag kadalasan nag-overreading sila. Overreading. No? Kaya marami na opera na ulit na marami. No? Thyroids 4, thyroids 5. No? Dati walang thyroids yan eh. No? Okay. So when they came out with new system, tendencies to overread. A lot of patients are being operated on, okay, unnecessarily. No? Okay. So I will try to prepare one for next time. Thyroid ultrasound and thyroid function test, how to interpret, how to read. Okay. So with that, let's call it a day. Okay.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc. See you Wednesday.
Thank you, Doc.
Thank you.
Thank you.
Thank you, Doc.
Bye-bye.
Bye.